ओम धम धन्वंतरे नमः। कर्पूरगौरवं करुणावतारं संसारसारं भुजगेन्द्रहारं सदा वसन्तं हृदयारविन्दे अहं भवानी सहितं नमामि। Today's topic is standardization of herbal drugs. Whenever preparing a formulation, the raw materials has to be authenticated and standardized. Even after the formulation is formed, it will be standardized, then it is well to market or use in the patients. Herbal drug standardization and evaluation in recent years there has been great demand for plant-derived products in developed countries. These products are increasingly being sought out as medicinal products, nutraceuticals, and cosmetics. There are around 6,000 herbal farm manufacturers in India. More than 4,000 units are produced Ayurveda medicines. Due to lack of infrastructures, skilled manpower, reliable methods, and stringent regulatory laws, most of these manufacturers produce their product on the very tentative basis. In order to have a good coordination between the quality of raw materials, in-process materials, and the final products, it has become essential to develop reliable, specific, and sensitive quality control methods using a combination of classical and modern instrumental method of analysis. Standardization is an essential measurement for ensuring the quality control. So standardization of the analysis of herbal drugs, there are 4 points: physical, bacterial, biological, and chemical. Under physical characters, moisture content, ash value, extract value, viscosity, density, bitterness value, solubility, swelling index, foaming index, and this specific gravity. These are physical. Chemical tests, microscopic and macroscopic. Macroscopic includes color, odor, taste, texture, and fraction. Microscopic includes qualitative, quantitative, semi-analysis, and for studies. Biological, we have microbial contamination, pharmacological evaluation, toxicological studies. And under chemical tests, chromatographic techniques, heavy metal pesticide residue, and mycotoxins. Another one. Okay. First, collection of raw material, then bacterial identification, botanical identification, and stabilization, frying, freezing, then grinding or powdering, an extraction process, then qualitative analysis, chromatographic techniques, then isolation of active compounds, purification, then fractionation and toxicity evaluation. Standardization expression is used to describe all measures which are taken during the manufacturing process and quality control, leading to a reproducible quality. It also encompasses the entire field of study from birth of a plant to its clinical application. It also means adjusting the herbal drug preparation to a defined content of a constituent or a group of substances with known therapeutic activity, respectively by adding excipients or by mixing herbal drugs or herbal drug preparations. Evaluation of a drug means confirmation of its identity and determination of its quality, purity, and detection of its nature of adulteration. Standardization of herbal drugs is not an easy task, as numerous factors influence the bioefficacy and reproducible therapeutic effect. In order to obtain quality-oriented herbal products, care should be taken right from the proper identification of plants, season, and area of collection, and their extraction and purification process, and rationalize the combination. First, authentication. Each and every step has to be authenticated. Stage of collection, parts of the collected plant, regional status, botanical identity like phytomorphology, microscopical and histological analysis. That is, characteristic of cell walls, cell contents, starch, grains, calcium oxalate crystals, trichomes, fibers, vessels, etc. And various histological parameter studies are leaf content, palisade ratio, vein slit number, vein termination, stomatal number, stomatal index, trichomes, stomata, quantitative microscopy, and taxonomical identity, foreign meta, organoleptic evaluation. Also, hash values and extractive values, moisture content determination, chromatographic and spectroscopic evaluation, heavy metal determination, pesticide residue, microbial contamination, and radioactive contamination. Herbal formulation in general can be standardized schematically as to formulate the medicament using raw materials collected from different localities and a comparative chemical efficacy of different batches of formulation are to be observed. Preparation with better clinical efficacy are to be selected. After all, the routine physical, chemical, and pharmacological parameters are to be checked for all the batches to select final finished product and to validate whole manufacturing process. Stability parameters for the herbal formulations include physical, chemical, and microbiological parameters. For physical parameters include color, odor, appearance, clarity, viscosity, moisture content, pH, disintegration time, friability, hardness, flowability, flocculation, sedimentation, setting rate, and hash values. Chemical parameters include limit tests, chemical assays, etc. Chromatographic analysis of herbals can be done by using TLC, HPLC, HPTLC, GC, UV, and GCMS, and fluorometry, etc. Microbiological parameters include total viable content, total mold content, total enterobacterial and their count. Limiters can be utilized by quantitative or semi-quantitative tool to ascertain and control a number of impurities like reagents used during extraction of various herbs. Impurities coming directly from the manufacturing vessels and from the solvent system. The guideline, and let us see what are the guidelines for herbal drug standardization. First, WHO guidelines. The subject of herbal drug standardization is massively wide and deep. The guidelines set by WHO can be summarized as follows. Reference to the identity of the drug, botanical evaluation, sensory characters, foreign organic matter, microscopical and histological, histochemical evaluation, quantitative measurements, etc. Refers to the physiochemical character of the drug, physical and chemical identity, chromatographic fingerprints, hash values, extractive values, moisture content, volatile oil and alcohol assays, quantitative estimation protocols. One is reference to be to as a reference to the pharmacological parameters, biological activity profiles, bitterness values, hemolytic index, astringents, swelling factor, foaming index, etc. Fourth one, toxicity details, pesticide residues, heavy metals, microbial contamination like total viable count, pathogens like E. coli, Salmonella, P. aeruginosa, Staphylococcus aureus, Enterobacteria, etc. Fifth one, microbial contamination. Fifth one is radioactive contamination. Modern herbal Ayurvedic monographs. The modern herbal Ayurvedic monographs, the standardization parameters are discussed in a comprehensive way. According to the modern Ayurvedic monograph, the quality control protocols include the following: synonyms, publication related to the plant, constituents present, analytical methods, descriptive evaluation, description of the drug, phytomorphological, microscopical, organoleptic evaluation, etc. WHO guidelines monograph botanical, sensory evaluation, foreign matter, microscopic measurement, physiochemical HPLC, ash, extractable matter, water content, and volatile matter, volatile oils, pharmacological, bitterness value, hemolytic activity, astringency, Sterling index, foaming index, and toxicological, pesticide residue, arsenic, metals, microbial contamination, total viable count, pathogens, aflatoxins, radioactive contamination. The standardization of herbal drugs. Commercial production of herbal medicines and their trade are the fastest growing sector of industry today due to increasing demand of medicinal plants. Supply line is adversely affected, leading to adulteration and substitution for genuine drugs. Fluorescence quenching. The plant extract is spotted on a fluorescent silica gel layer and exposed to ultraviolet light. It appears as a spot on a fluorescent background, thus causing quenching, and is directly proportional to the concentration of the extract. Use of fingerprinting and marker compass for identification and standardization of botanical drugs. Chemical and chromatographic techniques may be used to aid identification of herbal material extract. Okay. Chromatographic techniques such as HPLC, DLC, GC, and capillary electrophoresis, and spectroscopic methods such as IR, NMR, and UV may also be used for fingerprinting. DNA fingerprinting has been widely used in many species. Densitometric thin layer chromatographic determination of resin then herbal medicinal product containing solemn and vitis. Very exactly the example. Elemental analysis of herbal trained for traditional medicine by neuron activation analysis with the KO standardization. Liquid chromatography, ultraviolet examination, and liquid chromatography, atmospheric pressure, chemicalization, mass spectrometry, characterization of substances of cloud, FPLs, also procedure, detect. Thank you for patient.